Assalamu alaikum. My name is Samra Naseer. My roll number is DP1650197. Our course number is PHP 705. Course in charge is Ma'am Shahana and my topic is glucose. First, we are discussing what is glucose. Glucose is key to keeping the mechanism of the body in top working order. Whenever glucose levels are optimal, it often goes unnoticed. But when they stray from the recommended boundaries, you will notice the unhealthy effect it has on normal function. It's the simplest of the carbohydrate, making it a monosaccharide. This means it has one sugar. It's not alone. Other monosaccharides include fructose, galactose, and ribose. Before eating, a healthy range is 90 to 130 milligram per deciliter. After an hour or two, it should be less than 180 mg per dl. Now, what are the rational use of glucose? Glucose is an essential carbohydrate that is used as a substrate for energy production within the body. Although many organs use fatty acids as an alternative energy source, the brain is totally dependent on glucose as its major energy source. Thus, hypoglycemia may cause serious brain injury rapidly. Dextrose administered with insulin shift potassium intracellularly and maintain euglycemia for treatment of calcium antagonist and beta adrenergic blocker poisoning. Hyperinsulinemia, euglycemia therapy. What are the irrational use of glucose? Means the toxicity of glucose. Hyperglycemia and serum hyperosmolarity, local phlebitis and cellulitis after extravasation occurs with concentration less than 10% from the intravenous injection site. Administration of large glucose load may precipitate acute Wernicke-Korsakoff syndrome in thiamine depleted patients. For this reason, thiamine is given routinely along with glucose to alcoholic or malnourished patients. Administration of large volume of sodium-free dextrose solution may contribute to fluid overload, hyponatremia, hypokalemia, and mild hypophosphatemia. Use in pregnancy, FDA category C. This does not preclude its acute short-term use for a seriously symptomatic patients. Now, what are the uses of glucose? Glucose mainly used in the condition like hypoglycemia, empiric therapy for patients with stupid coma or seizures who may have unsuspected hypoglycemia, use with an insulin infusion for severe calcium antagonist poisoning, beta blocker poisoning, hyperkalemia. What are the alternatives of glucose? Glucose supplements like dextrose, glucose elevating agents like glucagon, glucagon intranasal, inhibitors of insulin secretion like octreotide or diazoside. These are the different brands of glucose. Drug-drug interactions. High level of glucose in diabetics can react with plasma proteins through a non-enzymatic process. Herein, the influence of glucose on the interaction between flavons and human serum albumin was investigated, as well as the effect of glucose on the antioxidant potential of a flavon HSA system, it looks like the interaction of HSA and flavons with more hydroxyl group on ring A are more easily affected by glucose. Flavons act as a hydrogen bond donor with HSA by means of interacting with glucose with increased incubation time in air. The affinities of HSA for multi-hydroxyl flavons on ring A were obviously higher than for non or mono-hydroxyl flavons on ring A. HSA significantly masked the DPPH radicals scavenger potential of 7-A-dihydroxyflavone and benzene. However, glucose obviously enhances the DPPH scavenging potential of a biserine HSA system. Moreover, glucose slightly weakens the DPPH scavenging potential of a 7-8 dihydroxyflavone system. Now, what is the antidote of glucose? The antidote of glucose is insulin. Case study. IH is an 82-year-old white woman who presented to her primary care physician with a 20-year history of episodic confusion and somnolence. The episodes occurred about twice a year, typically in the morning, just after waking. They lasted minutes and were relieved when she ate her breakfast or had juice. Over the 8 to 10 months before presenting, the patient noted that the episodes were increasing in frequency as well as occurring throughout the day. When IH presented to her primary care doctor with the above complaint, the patient was reassured as she was waiting for checkout. She developed confusion after primary blood glucose test was performed, and she was noted to have a plasma glucose level of 28 mg per day. She was given juice and her symptoms resolved after a few moments. The patient was subsequently admitted to the hospital for further workup. On exam, IH was found to be a well-nourished woman in no apparent distress. Her vital signs were significant only for mild hypertension. Her physical and neurological exams were unremarkable. Her admission lab values were significant for a glucose level of 6 mg per day. She was completely asymptomatic upon presentation and was thus placed on a fasting protocol. In this case, as is true in most centers, the serum insulin, C-peptide, and sulfonylurea levels were not readily available before the fasting protocol was continued and she became symptomatic. The subsequent lab results were consistent with the suspected diagnosis of an insulin-secreting tumor. To replace the tumor, IH had an abdominal CT with contrast, which reveals an enhancing mass in the pancreatic head suggestive of an insulinoma. Now, what are the laboratory tests of the IH patient? In different time interval, the blood is taken from the women to examine the insulin level, serum glucose level, serum C-peptide, and the sulfonylurea. And we get the different result at different time. Subject, gender, female, age 82 years, history. A 10-year history of episodic confusion, somnolence. The episodes occur about twice a year, typically in the morning just after waking. The episodes occur about twice a year, typically in the morning just after waking. They lasted minutes and were relieved when she ate her breakfast or had juice. Objective. In objective, we wrote the lab result in which we wrote serum glucose level, serum insulin level, serum C-peptide, and the sulfonylurea levels at different time intervals, which were mentioned in the case. Lane. Dioxide is related to the thiazide diuretics is recommended and reduce insulin secretion as assessment. In malignant insulinomas, brachytherapy with frequent oral feedings और एंट्रेरर पे यार गलत हो गया